The purpose of it is to implement an effective system by facilitating people's access to safe and quality health and social services. The CAQ government is planning on reforming the province's health network by creating an agency called Santé Quebec. Health Minister Christian Dubé introduced Bill 15 on Wednesday, an act to make the health and social services system more efficient. The agency would coordinate the operations of the network, becoming the sole employer of healthcare workers in the province rather than the 34 that currently exist. It would also create 4 collective agreements rather than 136. A service quality and complaints commissioner would be appointed and mobility of personnel encouraged. This all to hopefully reduce wait times in ERs.
We have is human resources. That's clear. And if we have happy resources, we will have happy patients. So what we need to change is to say that most of our employees have still that in mind, that once upon a time, there was a culture of the patients. There was a feeling of being part of a team in one hospital. This has been lost.
Bill 15 just seems like another painting lipstick on a pig and trying to show it off as it's possible. It's not. What we're doing right now is hiring more bureaucrats, creating an agency called Santé Quebec, and taking responsibility away from the Ministry of Health.
My concern is that they're going to be nominating people. These are going to be more bureaucrats who are going to answer to a central authority. So even though they talk about being concerned about the local needs, it sounds like it's all going to be top-down management.
Quebec reserved $60 million over 2 years for the creation of Santé Quebec.
Improving working conditions and more flexibility for working conditions, working with the unions to create that. I think those are all positive. I don't think creating one single government agency to run everything is the way to go.
The bill also differentiates salaries according to regions and shifts.
The first thing that we need to do is get back nurses and personnel in the system.
We're losing staff, and it's becoming harder and harder to maintain. And the idea of having health operators or managers coming in and saying, well, we're going to cut here, we're going to cut here, and we're going to make everything come together. It doesn't work. We need collaboration.
Dubé says he wants to collaborate with the unions for this to succeed.
If we are able to give them good conditions, so instead of going to private or to agencies, they are able to say, oh, I can see the changes. Give us the confidence that we are working this turnaround that we do right now. And I think that they will be very proud.
In Montreal, Alyssia Rubertucci, City News.